Hello guys! The 2020 year has started with a big disaster of virus attack. A new coronavirus, designated as 2019 nCoV, was identified in Wuhan, the capital of China's Hubei province, after people developed pneumonia and respiratory problems without a clear cause and for which existing treatments were not effective. The virus has shown evidence of human-to-human transmission, with its transmission rate escalating in mid-January 2020 and several countries reporting cases across Europe, North America and especially the Asia-Pacific. Its incubation period is between 2 to 14 days, but there is evidence that it may still be contagious during this period and possibly for several days after recovery. Symptoms include fever, coughing and breathing difficulties, and it can be fatal. As of the 2nd of February 2020, approximately 14,570 cases have been confirmed, including in every province-level division of China. The first confirmed death occurred on the 9th of January 2020, and since then 307 deaths have been confirmed. A larger number of people may have been infected, but not detected. The first local transmission of the virus outside China occurred in Vietnam from a father to his son, whereas the first local transmission not involving family occurred in Germany on the 22nd of January, when a German man contracted the disease from a Chinese business visitor at a meeting near Munich. The first death outside China was reported in the Philippines, where a 44-year-old man confirmed to have contracted the coronavirus, Streptococcus pneumoniae and influenza B died on the 1st of February 2020. In response, cities comprised of Wuhan and 15 other cities in the surrounding Hubei province were placed on full or partial lockdown, involving the termination of all urban public transport and outward transport by train, air and long-distance buses. Many New Year events and tourist attractions have been closed to prevent mass gatherings, including the Forbidden City in Beijing and traditional temple fairs. Hong Kong also raised its infectious disease response level to the highest level and declared an emergency, closing its schools until March and cancelling its New Year celebrations. A number of countries have issued warnings against travel to Wuhan and Hubei province. Travelers who have visited mainland China have been asked to monitor their health for at least 2 weeks and contact their healthcare provider to report any symptoms of the virus. Anyone who suspects that they are carrying the virus are advised to wear a protective mask and seek medical advice by ringing a doctor rather than directly visiting a clinic in person. The outbreak has been declared a public health emergency of international concern by the World Health Organization, explaining that its decision was based on the possible effects that the pathogen could have if it spreads to countries with weaker healthcare infrastructures. The declaration makes it the sixth time that the measure has been invoked since the H1N1 pandemic in 2009. Wuhan is the capital of Hubei province with a population of more than 11 million people. It has been a major transportation hub of the country. In Wuhan, during December 2019, a cluster of cases displaying the symptoms of a pneumonia of unknown cause was linked to Huanan Seafood Wholesale Market, which had 1,000 stalls selling fish, chickens, pheasants, bats, marmots, venomous snakes, spotted deer, and other wild animals. The immediate hypothesis was that this was a novel coronavirus from an animal source. Coronaviruses mainly circulate among other animals but have been known to evolve and infect humans, as in the cases of severe acute respiratory syndrome and Middle East respiratory syndrome, together with 4 further coronaviruses that cause mild respiratory symptoms similar to the common cold. All coronaviruses known to infect humans have been shown to spread between people. Transmission of coronaviruses is primarily thought to occur among close contacts via respiratory droplets generated by sneezing and coughing. Chinese scientists were able to quickly isolate a strain of the coronavirus and publish the genetic sequence so that laboratories across the world could independently develop PCR tests to detect infection by the virus. The WHO had praised the Chinese for their swift efforts. On the 17th of January, an Imperial College group in the United Kingdom published a report that there had been 1,723 cases, 95% confidence interval, 427–4,471, with onset of symptoms by the 12th of January. This was based on the pattern of the initial spread to Thailand and Japan. Based on cases reported and assuming a 10-day delay between infection and detection, researchers at Northeastern University and Imperial College London estimated that the number of actual infections may be 10 times higher than those confirmed at the time of reporting. Imperial College estimated 4,000 cases with 440 confirmed by the 21st of January 2020. Northeastern University estimated 21,300 infections by the 26th of January, increasing to 26,200 infections by the 27th of January, with a confidence of 95% within the interval 19,200 to 34,800. On the 31st of January 2020, an article published in The Lancet estimated that 75,815 individuals have been infected in Wuhan as of the 25th of January 2020. There are concerns about whether adequate medical personnel and equipment are available in regions affected by the outbreak for hospitals to correctly identify coronavirus cases instead of misdiagnosing suspected cases as severe pneumonia. There are reports that it may spread even without symptoms. Symptoms may include fever, cough, shortness of breath, and diarrhea, and may vary from slight to very severe. Cases of severe infection can result in pneumonia, kidney failure, and death. Upper respiratory symptoms such as sneezing, a runny nose or sore throat are less frequent. The time from exposure to onset of symptoms is estimated at 2 to 10 days by the World Health Organization. Coronaviruses are primarily spread through air droplets expelled when an infected individual coughs or sneezes within a range of about 3 feet to 6 feet. There is also a possibility of fecal-oral transmission. A doctor in a protective bunny suit sees a patient in a Wuhan hospital. The protocols to prevent infection vary depending on the likelihood of the susceptible individuals making effective contact and general differences in medical philosophy between culture. Official advice has generally been limited to calls for good personal hygiene and regular hand washing. Those who suspect themselves to be infected are asked to wear surgical masks and call a doctor for medical advice. A significant number of countries have issued advisories warning against travel to either mainland China, the province of Hubei, or just Wuhan. The public has often taken precautions beyond of what is advised by health authorities. There is widespread use of surgical masks by healthy people in Hong Kong, Japan, Singapore and Malaysia. Evacuation of foreign citizens. Due to the effective lockdown of public transport in Wuhan and Hubei province, several countries have planned to evacuate their citizens and/or diplomatic staff from the area, primarily through chartered flights of the home nation that have been provided clearance by Chinese authorities. Japan, the United States, France, Australia, Sri Lanka, Germany and Thailand were among the first to plan the evacuation of their citizens. Reactions to prevention efforts. The World Health Organization (WHO) has commended the efforts of Chinese authorities in managing and containing the epidemic, with its Director General Tedros Adhanom Ghebreyesus expressing confidence in China's approach to controlling the epidemic and calling for the public to remain calm. On the 29th of January, Russian President Vladimir Putin held a meeting on measures to counter the spread of coronavirus in Russia. On the 30th of January, U.S. President Donald Trump received a briefing on the coronavirus in China. Several organizations around the world are developing vaccines or testing antiviral medicine. In China, the Chinese Center for Disease Control and Prevention (CCDC) has started developing vaccines against the novel coronavirus and is testing existing drug effectiveness for pneumonia. Also, Hong Kong researcher Yuan Kwok Young and his team in the University of Hong Kong announced that a new vaccine is developed but needs to be tested on animals before conducting clinical tests on humans. The Russian consumer health watchdog Rosporebnadzor started the development of a vaccine, relying on the WHO's recommendations. The impact of this coronavirus, the epidemic coincided with the New Year, which marks a major festival season for the region and the busiest travel period in China. A number of events involving large crowds were cancelled by national and regional governments, including the annual New Year festival in Hong Kong, with private companies also independently closing their shops and tourist attractions such as IKEA and Hong Kong Disneyland. Hong Kong has been recovering from high-profile protests that saw tourist arrivals from mainland China plummet over an 8-month period. The viral epidemic has however placed doubt on the ability of the travel sector to withstand a prolonged period of downturn. Japan Prime Minister Shinzo Abe has said that the new coronavirus is having a major impact on tourism, the economy and our society as